I'm a family medicine doctor, so I did a family medicine residency. I did not do an adolescent medicine fellowship, which is where most people learn about eating disorders. I'm not a psychiatrist. Some psychiatrists have specific training in eating disorders, but PCPs in general, family physicians, internists, pediatricians, we maybe have a couple weeks. If we
Wow.
rotated in an adolescent medicine inpatient unit, we maybe had a couple weeks of exposure to eating disorders. And those were obviously like the sickest of the sick, right? The inpatient patients. Very, very, very unlikely that we ever saw, to our knowledge, because we did, but to our
Right.
knowledge, a patient in an outpatient setting who had an eating disorder that we were aware of.
Wow.
The likelihood is just super low because it's not uncommon, but if you don't know what to look for, you can easily miss it, and the patient's
Right.
not necessarily coming in to tell you about it either.
No,
Um,
exactly.
part of their disorder is that they're minimizing their symptoms. They're maybe not being forthcoming, or they're ashamed and they don't want to, maybe they want help, but they're not sure how to say it, or they've tried in the past and been judged. They've had trauma. There's so many things that could limit the ability of them to share with you what you need to know. And then the physician may not have had any training in it to know what to look for. So it's really easy to be missed. And another thing that I think is really important for people to be aware of when it comes to PCPs is if you take insurance, insurances all have these quality metrics, and they're all moving to this like value-based care model, which means you get paid by the insurance company based on certain metrics for your patients. And those metrics are often things like blood pressure, A1C, which is the average blood sugar marker for prediabetes and diabetes, cholesterol panels, BMI. Okay. So you are paid based on how your scores are on these numbers. Those are the numbers you're going to be focusing on because
Wow.
otherwise your clinic can lose money. And that is, most physicians now are employed. Most physicians now are not, privately contracted with these insurance companies. But if you're employed, you are told by your employer, like, these are your numbers. What's wrong with your numbers? Why aren't your patients? So, like, yeah, if you see someone who comes in and their BMI is normal and their labs are normal, like, that's not a priority. I got all these other people that are very sick with severe metabolic health concerns that I'm getting graded on.
Right.
That's where a lot of the clinic resources are spent. And so these people get missed who are really struggling, and it's
Right.
not as if their condition is any less serious, but it's not flagging anyone. And the resources to address it are being utilized for other people who have more measurable, obvious conditions.